One. Welcome to South Charlotte Sports Report Live. I am truly honored today to have the North Carolina Secretary of Health, Dr. Mandy Cohen, with us, and I want to thank you for joining us today as we learn more about how COVID-19 affects students and families. Good
Great to be with
afternoon.
you.
Yes,
Well,
I'm so glad to have you. As I was telling you earlier, you've all of a sudden become the most recognizable person in the state.
uh, just trying to do my job and help us navigate these challenging times. But thanks for that. Happy to be on and talk about this important topic.
Yeah, talk about a little bit. Kids seem to be the least affected by this disease, but up until now, anyway, they've kind of been some of the most confined. Can you kind of talk about that a little bit?
Yeah, that's been hard, and I think we're still learning about this virus, and we should say that we should be humbled by this virus because it is deadly, particularly to people who are older or people who have chronic diseases. So people even who don't die can get very sick, and so it is really a worrisome disease. But the good news is it really doesn't seem to be impacting kids under 18 in the same way it's impacting adults, which is fantastic
Yes.
and great. Like I'll say as a parent, I have a 5 and an 8-year-old, and the fact that I can know that even with all of this going on, the fact that if they got sick, they're going to recover from this like the common cold, that's great. The question has been, are they vectors? Are they conduits? Could they spread the disease even if they don't get sick? And actually the studies have been a little mixed on that in terms of how the kids spread the virus a lot. And now the studies aren't as great because most of us have closed schools. To your point, kids haven't been moving around. So we haven't gotten as much data about kids that we wanted to get. And so that's why as we try to move through these easing of restrictions that I know we'll get into, we know kids aren't going to get sick, but the question is, do they transmit the virus to grandma and grandpa? Right?
Exactly.
And so that's the question. And so that's why we're navigating through this. I'm not necessarily worried about their health, but it is about how much virus is circulating in the community. How much are they bringing home to mom and dad who may have, diabetes or asthma, or to grandma and grandpa who are both older and may have chronic disease. That's the rub that we're trying to still figure out. How much are kids transmitting the virus, not necessarily getting sick from it.
Right, I fully understand. Let me go into an area that really concerns me, and I know it concerns you as well. I speak to a lot of parents, and I also mentor a lot of young athletes. I keep hearing more stories of increased anxiety and increased depression inside the house from parents. And obviously, what do you think we as parents, how do we address that? Because obviously, if a mental issue goes too far, you can't ever correct it. And I think you know what I'm talking about there.
Yeah.
What is your best advice to parents that are just seeing their children act a little bit different right now?
Yeah, look, and I would say first there is a lot of help and guidance out there. I am not a psychiatrist by training. I'm an internist by training, but I have many psychiatrists and other behavioral health professionals both on my team and in our network who I know have been working hard on this issue. And it is children and adults. This is just an anxious, stressful time. There's fear. What's going to happen? Are out of our routines. Like what's going to happen? So we know that even the non-anxious kids, everyone's anxious because this is just hard times. But particularly for kids who had behavioral health issues, anxiety, depression beforehand, it's even more challenging. So what I would say is be attuned, right? Be attuned.
Right.
Be continuing to watch for warning signs and get help early. There's help out there. Even if you don't feel comfortable bringing someone in person, there's a lot of opportunities for virtual care. So to do what you and I are doing right now,
Exactly.
for behavioral health, a lot of that is just about talking and interacting face to face, even if it's virtual with folks. So we also have a bunch of free resources. There's a new hotline that's available all to North Carolina 24/7 about just COVID-related mental health things, if folks want to call it. And of course, the thing we're most trying to prevent, obviously, is suicide. And the suicide hotline is always there. Want folks to reach out and have a low threshold for reaching out if you're worried. And that's what I say. Look for a warning sign, reach out early, and talk about this with your kids, right? Talk them through the fact that, hey, actually COVID-19 doesn't make kids sick, but these are the risks. This is how we're going to try to make everyone safe. And we're going to get back to the things that we love. And I know we're going to talk about some of the sport things, but get them outside, get them swimming. The pools are opening this weekend. Get go for a walk, go for a run, go, the physical activity. I mean, and this, better than that really helps everyone's mental health. It does mine. And so that's been a stable thing for my kids. Every week we've been doing outdoor walks, bike rides, runs together as a family. So that's what I would suggest. It's not perfect, but we'll get through this.
Right, exactly. Good point. We'll go ahead into this. Wednesday, the governor released an executive order, and all of us all of a sudden became lawyers trying to interpret everything. And Lord, I know my emotions were like a roller coaster reading through it, being attached to all sports, but specifically in my house with baseball. Tell me, you've got something coming out later today. Go ahead and tell me what you told me earlier about the fact that my son can play baseball now.
That's right. Good news. So here's where we are with youth sports in particular. There's nothing in the executive order that prevents youth sports from happening. So that's one. They will still be subject to the mass gathering limits. So when you think about parents and others, going to watch the games, we still want to keep that low. So if you're outdoors, we're trying to keep folks less than 25 folks sort of watching a game. But what I would say, there's no restrictions. We are making recommendations that will come out today from our department. We've worked with the High School Athletic Association and others on this guidance. What our guidance is going to be preliminarily is that we are going to recommend against contact sports.
Right.
But say move forward with non-contact sports. And baseball is a non-contact sport. Right, where you're able to have social distancing be part of what you're doing, that's fine. Tennis, golf, swimming, other individual sports, equestrian. So those non-contact sports go forward. Now, when you start to talk about basketball, you're right in there. You're breathing hard on each other. That's a different place. And what I would share is let me step back and do a little bit of like the why. Why are we even thinking about contact versus non-contact, right? Just remember that this is a virus that's spread from respiratory droplets. What that means, it comes out of your mouth and your nose. And when you're doing athletics, you have more respiratory droplets, right? We all know when we breathe hard, we're working hard, playing our sport, like more respiratory droplets come out of our nose and mouth. So when you're doing that, plus you have a contact sport where you're right in people's faces, like that's a pretty high risk exposure. And as we were saying before, kids, maybe I'm not worried about them getting sick, but it's a matter of, are they then going to have it and transmit it to someone else in their home who might be high risk, or just being out and around in the community. So that's why recommending no contact sports, can do non-contact sports, but for the spectators, still want to have folks abide by the mass gathering rules. And then we'll have a list of guidance on how to be as safe as possible, even when you are doing those non-contact sports. It's not going to be super detailed on every single sport. It'll have its own little nuance, but it'll be the big guidance, particularly when you're thinking about locker rooms or those kinds of shared spaces that you may go indoors. And I'd say any sport that you are thinking about doing outdoors, please keep as much outdoors as we possibly can.
Right. So just quickly, baseball game going on, 18 kids, a few kids in the dugout, spread out in the dugout, 25 parents spread all the way around a 300-foot baseball fence. There's no issue there.
Correct. So, but I would say, look at that guidance. And yes, I think the dugout thing, you want to be spaced. And it's good, use good judgment, right? Make sure there's hand sanitizer around for kids if you're not near a bathroom, those kinds of things. When you're not, like for the parents who are there, wearing a face covering, right? The hard part about COVID-19, while it makes some people really sick, some people don't even have any symptoms, which is so mind-blowing about this whole thing. And so we want everyone to wear a mask just in case you have it and you don't know it. So face covering for the parents. Obviously, when you're up at bat and you're running around, that's a different scenario. But as much face covering as you can get, the hand washing 6 feet apart, that's the general guidance. But yeah, baseball, look, we recognize we want kids to get back to some of that, those normal activities, but just be smart about it.
And just tell me, a gathering versus being socially distanced. If there's I'm not talking any sport right now. I struggle with this at times.
Yeah.
If people are all 6 feet apart, 7, 8 feet apart, that is not a gathering. Is that correct?
This is the gray zone of this, and I think
Yeah.
it's right that you're asking this question. I mean, here's the issue, right? If you're all saying, "Oh, let's get together for a party of, and we'll just be really far apart," but the reason you go to get together is so you can be together, right? And
Right.
so you can say, "Oh, we're going to stay 6 feet apart," but we all know, like, the reason you're doing that is so you can gather. And
Right.
so so we're trying to say, look, use good judgment, keep it to 25, even when you do keep it to 25, space yourself out. So I think
Right.
it's both that we want to do, because look, we're all human. We want to be together. We've missed each other. And so we just want to be as smart as we can and as safe as we can. So keep it to 25, and even when you do, space yourself out.
Understand. Okay.
Yeah.
Here in Charlotte, as I think a lot of, in the Triangle as well, we've got quite a few high schools with 3,000 kids, middle schools with 1,800 kids, elementary schools pushing 1,000. What what do you
Yeah.
envision 3 months from today? I mean,
Yeah.
I'm not holding you to anything, but how in the world are we going to put 3,400 kids inside of a high school?
Yeah. No,
3 months, it would be 3 months from now.
yeah, and frankly, some that have year-round
Oh, yeah.
calendars, it could be as soon as the middle of July. So we're actively working with Department of Public Instruction on these right now. And basically, what we're going to ask school districts is to come up with scenarios, options. Let's go with the best case option, which is like everyone goes to schools kind of like normal, but you do things like more hand sanitizer, no field trips, no assemblies, probably lunch in your classroom, those kinds of things, probably some extra school nurses, those kinds of things, but no density reduction, meaning that everyone comes normal every day. Then think about the other extreme, which is what we're doing now, and make sure we have a plan to keep that going if we absolutely
Right.
needed to. And then come up with this middle option, is what we're calling something in between, that might need to do somewhat what we call in public health density reduction, so less kids coming on any given day. Now, my hope is that we can stay with that first scenario, which is all the kids are coming, but we just got to do some of these social distancing, particularly in high school. High school kids can keep a face covering on and do those things, like doing those things to keep the virus spread low. I think that would be our hope. But we got to look at the numbers and just sort of know what phase we're in. And again, this is less about my concern of each kid and what would happen to them getting sick, but it's like, are they going to transmit virus amongst them, bring it home to grandma, and what does that look like? But look, one of our highest priorities is to get kids back to school.
That's
Um, and that is not just selfish because I want my kids to go
Yeah.
back to school, but
They want to
look,
go back. They
they
really
want to go
do.
back. They need to be learning, absolutely. So as I think about all of the priorities that we have to reopen things, school is, we really want to get back there, but it is a huge step forward, right? Because you're
Right.
just saying thousands of kids potentially so it's not easy. And then look, we have teachers who are older or have
Right.
chronic diseases, and that's we got to work through that issue too. So we're still have some work to do there.
Right. Just a couple more questions. I know you have to go meet with Governor Cooper here in a few minutes. What do you anticipate this disease is headed in the next 12 months, as well as do you see a day in the next 12 months that life can be like it was in February?
That's such a hard question. Look, I hope for the best and plan for the worst, and that's the kind of job that I'm in. But what I would say is what I'm seeing right now is that we don't have a vaccine, and we don't have a medicine that can treat this in a way that helps us keep folks from dying or go to the
Right.
hospital. So I think what we are looking for in over the next year is living with this virus amongst us, and how do we protect ourselves in the best way possible. And that's why we have to take action across the board. And that's going to feel hard and different. But I think if we can all take that collective action, we can keep the virus spread low enough that we can get to most of the things that we love. Maybe not all, but most of the things. It may feel a little different. We have to do the kind of, the face covering thing and the wash your hands stuff. But that's what I envision for the next year until we have a vaccine. Now,
That's really the key.
Yeah, I'm hopeful the vaccine gets accelerated. I'm hopeful for a medicine breakthrough. I'm hopeful maybe they do something different around testing, where if we maybe test everyone more, there's things that could happen and change this. And I hope for that. I know scientists are working on it, but I think we all should start to prepare for we're gonna be in this for about a year with the virus, and that we're going to keep the virus level. That the goal is keeping the virus level low, right? But we live with it, but for probably a foreseeable future for the next
Okay.
year until we have the vaccine.
I'll be in trouble if I don't ask this question by a lot of people. We
Uh-oh.
talked about contact sports, football. It's supposed to start in a couple
Yeah,
months.
yeah,
What in the world do they have to do to be able to play a game of football, whether it's, a local high school,
yeah.
NC State, East Carolina, my school, Carolina Panthers? What in the world?
Yeah.
That's going to be a difficult one.
Yeah, and so I do differentiate professional sports from the rest in terms of, as I think of my role in giving guidance to the state. Right, the professionals are getting paid money. They have a different relationship with their
Right.
employer. So I'll leave them in terms of assessing their own risk. As I think about the high school folks, and I know that these are important sports for everybody. uh, what we are saying right now in our guidance, like I said, nothing's prohibited. It is our recommendation not to do it. We're saying but teams can condition, right? They can get themselves in shape. You want to use dummies, like, right, so you're not pounding against each other, getting in each other's face. But there'll be limitations, right? That means you can't do everything you want to do in a practice. But I think there are ways to keep conditioning up and bringing, some of your players in to make sure you're doing that, watching tape, like those kinds of things, socially distanced. But I think we're just going to have to see where we are in terms of, can we go further than that? Again, recommendations, and then folks are going to have to make good judgments on their own. But let's see where we are. I'd love to get to a place where we can recommend all sports with some limitations, but they all go forward. But I think where we are right now is no contact sports for the time being.
Right. Dr. Cohen, one last thing.
Yeah.
Offer some hope to students and athletes.
You can play baseball this summer.
Hey man, that's big time hope to me.
And
But
tennis.
just leave us with a positive message.
Yeah,
And I
look.
think you've been very positive throughout this. And this has been wonderful to hear and sit down with you. But leave us with a message of hope.
Yes, look, the thing is that we know there's some easy, basic things that we can do to keep the virus low. It's wearing a face covering, it's waiting 6 feet apart and washing our hands. Like, that's not major. That everyone can do, and it's the idea of it that we all do it together, whatever setting we're in, whether we're a high school student or we're an adult that's a coach. If we're all doing it together, it's an act of kindness to each other, right? And I think it's that kindness that will pull us together as a state, because we want to get back to these activities, and I know that. So it's simple. It seems real basic: face covering, wash hands, wait 6 feet apart. But you do those 3 W's. I think we'll be able to, to pull together as a state and be successful here. So that's my note of
There you
hope.
go. Thank
The
you.
3 W's, and enjoy, outdoors and getting exercise, and appreciate the time today to talk.
Well, I hope that you can find some time to relax this Memorial Day weekend and be outside with your family. Thank you so very much for joining me here on South Charlotte Sports Report. This has been Dr. Mandy Cohen, the North Carolina Department of Health Secretary. Thank you so much, and I hope you have a wonderful weekend.
You too. All right. Have a good one. Bye-bye.
Thank you.